So you think you can be a nurse. You're ready. Well, tonight is another critical thinking challenge, part 2. This is name your patient's medication. Name your patient's medication, their medication history. So what I am going to do is I'm going to prepare you guys for my critical thinking event that so many of you have signed up for. 4,000 people have signed up for this event. Seriously, it is happening the end of the month. It is for any nurse who is preparing to get a nursing license either tomorrow or in the future. This is the event, Critical Thinking for NCLEX. I hope you signed up for it. If you have not, just go to remarnurse.com because that is where this is happening. This is going down. This is going down right here on Facebook at the end of the month, October 25th. So get in it. Tonight, we are going over again NCLEX, quick facts for NCLEX actually, and we will be doing the pharmacology section. I'm playing the patient, you're my nurse. So right now, fast fingers in the comments. Oh, wait, let me just stop back. I have to stop really quickly. It's International Nurses Day that is happening at the end of the month. I forgot to say that. So not only do I have 4,000 students signed up for this NCLEX Critical Thinking Workshop, but they are actually from all around the world. Hi, Sonia. How are you? Haven't seen you in a long time. I'm so happy to see you. They're from all over the planet because it's just amazing, the countries that are represented. Put your country on the screen so I can know that you are in the house. Liberia, Ghana, Jamaica, Puerto Rico, Guyana, I could just go on. Guam, Haiti in the house. United States is in the house as well, always, right? Anywhere from the furthest regions of the planet are going to be doing my critical thinking workshop. So shout out to you all. Right now, we're getting into it. Pharmacology, gotta love it. Nigeria, how could I forget? All right. Also, because it is International Nurses Day event coming up, we are giving free shipping all over to all of the international students on the virtual trainer. So this is a great time to purchase it right now. Colombia, what's up? All right. So here it is. Here are the reasons why I'm taking the medication. I want you to tell me the medication. All right. I'm your patient. I just sat down in front of you. I'm about to tell you the reasons I'm taking the medication, what it does to my body. You got to tell me the medication. I see you, Philippines. The Philippines, they say, is the capital of nurses. All right, here we go. Youngstown, Ohio, stand up. All right, first, here's the first medication. I am taking this. This is a medication that I am taking. And if I take it and I move around too quickly, I start to get dizzy. I'm taking a medication that I have to take in more potassium. All right. I have to take in more potassium with this medication. Here we go. This is pharmacology. I'm not playing games with you guys. This is a difficult challenge. You are trying to think of the medication based off of what I am saying. I am taking a medication, and when I take it, it produces a lot of urine. Okay. It produces a lot of urine, right? All right. Yeah. Thank you so much. Does anybody know what medication it is right now? Amaci. Am I saying that right? Amaci. I love you, Regina. The only way I passed NCLEX is because of quick facts and the CDs. Wow, that's taking it back. All right. International Nurses Day is coming up. Houston in the house. Liberia. Okay, no. I see you guys saying Lasix. It's not Lasix, but you're on the right track. All right, let me see if I can give you some more clues. This medication, it can be used to treat hypertension. This medication, what it does is it increases the excretion of water in the distal tubules of my kidneys. Does anybody need a hint? I see diuretics, but I'm looking for something more specific. Because remember, I'm a patient. So if I'm trying to tell you the medication I'm on, you can't just say diuretic. You can't just say that because you can't chart. I mean, we want to know something specific. All right. Does anybody need a hint? All right. It is a diuretic, but it's a specific type of diuretic. What other clues can I give you guys? So This medication can lower my potassium. Okay. This medication may cause sun sensitivity. If I have a sulfur allergy, I shouldn't take this medication. Does anybody know? Come on. I need the generic name of this medication. Diuretics is good, but I need y'all to take it one step closer. I am looking for it. Okay, so the answer I was looking for was a thiazide. I was looking for a thiazide diuretic, like, oh, some people did put it. I see people did put it. HTCZ. Yes, hydrochlorothiazide. That's what it was. Hydrochlorothiazide. Did you guys get that? Yes, hydrochlorothiazide. Good job. Okay, next medication. Here it is. Okay. And remember, I'm looking for the generic name. If you need a hint, I may give you one after a while. This medication, oh my goodness. This medication, the doctors put me on it because I was having angina. All right. And I was having angina, and they told me that I may notice an increase in my, no, that's too easy. I'm going to tell you that. They told me that this would get rid of my hypertension, and this medication, I couldn't take a beta blocker. So they put me on this other kind of medication that helps me to, keep my hypertension under control. And they told me I might have to watch my calcium. What medication is this? And remember, for NCLEX, we need to put the generic name. So there's a lot of different choices now. I done pretty much told y'all what it is. It's used for my hypertension. It will help also with angina, and I gotta watch my calcium. What is it? Just give me one. There's 4 choices that this could be. We're studying quick facts for NCLEX. Yes, it is actually a calcium channel blocker, but give me a name of a calcium channel blocker. Do you know one? All right, good job. It's a calcium channel blocker. Give me the name of one. I could tell you 4, but I'm only just looking for, just give me one name. What's the calcium channel blocker that you're most familiar with, that you're most comfortable with? Give it to me right now. I see it. Good job. This is critical thinking pharmacology. It's so much different. Last night, we did the pathophysiology, but do you know the medications that treat these conditions? So the condition is going to be treated by a calcium channel blocker, but can you give me a medication name that is actually a calcium channel blocker? This is good. This is good stuff. So, choices, yes. Verapamil is a calcium channel blocker. Amlodipine is a calcium channel blocker. Ditalizim is a calcium channel blocker. All right. Nifedipine is a calcium channel blocker. Most nursing students are familiar with verapamil, right? But we have nurses from all over international, so you may know one of the other 3. If you didn't think of a calcium channel blocker name very quickly, that is the subject you want to study, because I just named the 4 common ones, okay? All right. So calcium channel blocker, all right? Lisinopril is actually not a calcium channel blocker, all right? Are you guys ready for the next medication? Okay. Next medication, here we go. I am taking this psych medication. I am taking this psychiatric medication because I have some neologisms. I'm taking this psychiatric medication because I have some hallucinations. Okay. I don't like to take this medication. Because it causes me to have some extrapyramidal side effects. I do suffer from tardive dyskinesia because of this medication. This is my psychiatric medication, and I like it because with other psych medications, you have to watch a whole bunch of things, but this one's not so bad. Except for the extrapyramidal symptoms, and also Sometimes people take this if they're nauseated. The doctors might give it to them, but I'm taking it for a psychiatric purpose. What is the medication? What is the medication? All right. And remember, all of this is in your quick facts for NCLEX. No, haloperidol is a psychiatric medication, but people don't take that for nausea, right? What psychiatric medication do people take for nausea? Gotta know it. We went over it. I know we went over it. No, I don't know why everybody's thinking haloperidol. We don't give haloperidol for nausea. Do you guys see it? So the medications that I'm looking for, I know tonight was going to be a little tough. Because this pharmacology, you really have to know it in order to be able to match it with the condition. And that's why I say that is the way you truly study pharmacology. You have to study it within the condition that you're studying, as far as a disease process or a physical change. So the actual medication is a phenothiazine. It's a phenothiazine. And so I would have took Thorazine, Compazine, Stelazine, or Promethazine. Okay, Promethazine. All right. This is tough. This is a lot tougher than yesterday. Okay, here we go. Next medication. This medication can be brought over the counter. A lot of patients buy this medication and they take it all the time. And the reason why they are taking it is mostly due to musculoskeletal pain. Okay. This medication is taken for musculoskeletal pain. It can also decrease inflammation. What is this medication? What are people taking? It can also, so it's for pain. It's an analgesic. It's over the counter. It comes in pills. I take it sometimes if my knees hurt or my back hurts, I'm taking this medication. But I have to be careful because I really need to take it with food. Anytime you take this medication that I take, I remember the doctor told me to take it with food. What is that medication? Because if I don't take it with food, it can cause gastric ulcers. All right. Also, this can cause bleeding if I don't take it appropriately. Some people use it for fever, but it's not really the best for fever. What is this medication? I see you guys got it already. Oh my goodness. Good job. Yes. So I am talking about the non-steroidal anti-inflammatory medication. And so I would have taken, if you put naproxen, if you put ibuprofen, I would have even took indomethacin if you would have said that. But NSAIDs, yes. Naproxen, huge. You got to know this one, right? You got to know ibuprofen as well if you're taking your NCLEX. And you have to know that, yes, when you give these medications, you must take them with food, right? They can cause gastric ulcers. Most people were taking them for a musculoskeletal joint pain, back pain, hip pain. Good job. This is it. I see you guys. You're like, oh, this is tough, but you're participating. And so I'm happy about that. Okay, let me see what other ones do I want to do. I picked some and I said, I don't want to be too hard on them. But then again, I do. All right, so here we go. This medication I am using, it's another blood pressure medication, but I have to be very careful. The doctor said that before I take it, I have to check my heart rate. I have to take my heart rate, and I have to make sure that my heart rate is at a certain way. I also I have to watch my potassium levels, because if my potassium levels are low, then this medication can make me really, really sick. Okay. And I have to be careful because, again, if my heart rate is low, then I can't take this medication. What is the medication? I'm using it because The heart is not pumping as much as it should be. And so this medication is supposed to help me. What medication am I talking about? Come on, I gave you guys all the clues. I gave you guys all the good clues for it. I said it's a heart medication that I have to monitor my heart before I take it. My heart rate before I take it. Yes. Of course. No, okay, let me see. Let me make it more clear. If I start to feel nauseated, if I start to have vomiting, then I need to stop this medication because I have gotten sick from it. Yes, of course, it is digoxin. Digoxin is that medication. Good job. All right, moving on. Next medication is this. Just seeing. Okay, this medication is used. This medication is used to treat cancer. This medication is used to treat cancer, and it is very common. Sometimes it's given for rheumatoid arthritis, but mostly it's given to treat cancer. And it's in your Quick Facts book on page 91 if you have it. All right. And the antidote for this medication is leucorovin. Do you know what it is? That's all I'm going to tell you because I gave you the antidote. So if I gave you the antidote, you should know it. This is what I'm talking about with pharmacology. People think, oh, I just study this book one time, flip through it. No, you need to know this book front and back. What is the medication I'm talking about? It may cause thrombocytopenia. It's used, that's all I'm telling you guys. You got to drink a lot of water as well. Yes, I see the answer on the screen. Oh, you guys. Methotrexate. Methotrexate. Did you know that one? I'm going hard on y'all today. This is pharmacology. All right. This is a herbal medication. This is a herbal medication that, well, I guess I don't take it because I'm a female, but this is a herbal medication for males. So, male patients take it and it helps with their prostate health. What is this herbal medication that it's really for prostate health. I mean, that's what people are taking it for. You got to be careful because it has a diuretic effect. This herbal medication has a diuretic effect, but it's used to improve or promote prostate health. What is that herbal medication? I know you guys know this one. This is how we study for pharmacology. Just getting it in. That's how we do it. I'm giving you guys the condition. You give me the medical treatment for it. I want to see it on the screen. The correct answer is saw palmetto. Saw palmetto. Yes. All right. Let me see that one. This one. Okay. All right. This medication. All right, friends. This medication is, what it does is it helps to open up the, I was going to say, it helps to open up the bronchioles. It helps to open up the bronchioles. The therapeutic levels, the normal therapeutic levels of this medication are 10 to 20. 10 to 20. And it's a bronchodilator, but you have to be careful when you take this medication. You have to avoid caffeine. So you don't want to be drinking coffee and taking this medication. What is the medication that I'm talking about? It's a bronchodilator. The normal levels are 10 to 20. And so that means that it does have the ability to get toxic in your bloodstream. What is this bronchodilator medication that I'm talking about? You got to avoid caffeine with it, but it is very popular because it will really be effective. All right. It may even cause some tachycardia. That's how effective it is going to be. Works very quickly. What am I talking about? Nope. I'm not talking about albuterol. There's one more on the page. Yes. Theophylline. The first one. All right. Next medication. Did you guys get that one? It's here. It's on page 101. So I just gave you guys the setups of it. Okay. Next time I'll say starts with a T. I'll say starts with a T next time. Okay. Here we go. Next medication. Ooh, this is a good one. What do I know about this one? Okay, this is a medication that can be given subcutaneously or it could be given intravenously. Okay, this medication can be given subcutaneously or intravenously, and it is given to patients with symptoms such as how can I say this? Okay, this is given to type 2 diabetics. Patients with diabetes mellitus type 2. And it could be given intravenously or it could be given subcutaneously. What is this medication? And I want specifics. I want real specifics because I gave you like the biggest clue ever. If you're talking about diabetes mellitus type 2 and I'm talking about an intravenous medication that they could get. What is it? What is it? All right. You guys got it. Hi there. Come on in. We're doing pharmacology. This is a pop-up critical thinking. Have you signed up for my critical thinking workshop? It is happening October 25th. It is critical thinking for NCLEX. Everybody who struggles with critical thinking, you guys need to be on there. All right. Now listen. Insulin it is, but what type of insulin? Is it intermediate? Is it rapid acting? What insulin can be given intravenously and subcutaneously? There's only one. Good job. Regular insulin. Yes, of course, regular insulin. All right, next medication that I take. This medication, this medication, it can cause some memory loss when I take it. It can cause some memory loss when I take this medication. I have issues with convulsions. Come here. See, when you listen, shout out to all the mothers out there. I'm sitting here minding my own business, studying, and who comes in? My boy.
It's me, Mario.
So Mario, okay, hold on, honey. Today is my son's Michael. Today is Michael's birthday.
Yeah.
Tell him how old you are, Michael.
I'm only 5.
Michael's 5 years old today, and he obviously loves Mario. So I am just taking some time out from his birthday to study with you guys. So thank you thank you so much for showing up for class. All right, baby. Okay, no, mommy's studying for a little bit. Bye-bye. All right, so, and I'm off. All right. That's kind of embarrassing, but you guys know that's just how it is with kids. So anyways, happy birthday, Mario. All right, so I am on this medication. I said it can cause some memory loss. I take it because I have convulsions. And so they prescribed it for me, but I just can't remember because it causes memory loss. I can't remember what the medication is. And I want you guys to think about it. What medication is that? All right. This is it. This is how you study for NCLEX, kids and all. Your kids bust in on you. You give them a hug and you send them back out to do whatever it is they're doing. And you just hope that their dad is watching them because he's fully dressed in the costume. He's supposed to be in bed. So it didn't look like he was going to bed anytime soon. All right, so I am taking it's an anticonvulsant. What medication is it? It is not Dilantin. It starts with a G. What is it? That's the answer. It is Gabapentin. All right, did you guys get that? Okay. Thank you guys for wishing my son a happy birthday. So the next medication that I'm taking is used to help prevent stomach ulcers. It's used to help prevent stomach ulcers, and it also helps to reduce stomach acid. And you can give it before meals or you can give it with meals. What medication is this? This medication is used to prevent ulcers and reduce stomach acid. And it's specifically for that. So I don't want to go any more into that. Anybody know it? Oh, okay. So there's two choices in the Quick Facts book. We're studying Quick Facts today. You have famotidine. A lot of people, probably a lot of you take this, and then cimetidine. And these are both used as histamine or H2 blockers. Very, very important. Histamine or H2 blockers. All right. Let's talk some more medication. This medication is used for, okay, so now we're talking about a patient who she is in her 8th month of pregnancy, okay? She's in her 8th month of pregnancy. She comes in because she's having premature contractions. What medication can we give her to stop those premature contractions? However, if we give her this medication, she must have an indwelling catheter. What medication is that? Okay. There's only one that you guys could be thinking of. All right. Because this medication, it can cause some issues with the renal system and the urine output. So what are we going to give this maternity patient to help stop premature contractions, but also we have to watch the urine output very closely? What is the medication we're studying? This is how it happens. Okay. I don't see the answer yet. Come on, guys. All right. Are you with me? I'm hoping this is easy. This all comes from my virtual trainer, right, guys? Virtual trainer and Quick Facts. We talk about this medication a lot in the VT. So it's one of the more important ones of maternity. With NCLEX, you don't have to know everything about nursing, but there are some major principles that you do have to know and some major medications that you don't have to know. Sweet Pea says, wow, I remember when you was pregnant with him. Yeah, 5 years ago. 5 years ago. So the correct answer, great job, magnesium sulfate. Remember, when we give maternity patients magnesium sulfate, we have to monitor their urine output because it's going to decrease their urine output, their reflexes, and there's one more thing that magnesium sulfate will decrease. If you know what it is, put the 3 on the screen. All right, help somebody out. Somebody's going to learn today. We got a lot of nursing students following us now. And so my new nurses, you will learn a lot. Just stick with me, stick with this group. We're going to teach you a lot. All right, so that was magnesium sulfate. This medication that I am on now, oh my goodness. This medication is, which one is it? Oh, okay. Yeah. This medication is used for bipolar disorder. It is one of the most popular treatments for bipolar disorder. It really is. And it's a really special medication because it's also an electrolyte. So if you think about an electrolyte, we know that electrolytes end in like magnesium, calcium. I say this in my lectures. So what is this medication for bipolar disorder? All right. And good job, guys. Good job. The 3 things that magnesium sulfate will decrease are going to be urine output, respirations, and reflexes. So good job. But now I'm talking about the mood stabilizer medication for bipolar disorder that's really popular, really popular. And it is also an electrolyte, and it has a therapeutic level of 0.6 to 1.2. What is it? Excellent job. I am talking about lithium. Did you know that one is used for bipolar disorder? Very popular for bipolar disorder. Also remember with the lithium, if you're taking it, you can't just stop taking lithium. You have to gradually taper that medication down. You have to gradually taper that medication down. Good job. Yeah. Also in Quick Facts, it says you give lithium with food and then you don't give it with diuretics. Okay. You don't give it with diuretics. Okay. Moving on. Let's see here. All right. Next medication is this. That's too easy. You guys don't know that one. That one's too easy. Give me the, how can I make this? Okay. Give me the herbal medication that, okay, give me the herbal medication where 1 clove equals 4 grams. You have patients, they take it by cloves. What herbal medication is it? What is it? It's an herbal medication, and you can ask your patient, okay, how much are you taking? Are you taking a clove a day? Are you doing a clove a week? What is it? It's an herbal medication. Anybody know? You guys are putting the answers on the screen so fast. I got to prepare my next one. While you're thinking of that one, 1 clove equals 4 grams of the medication. What is the medication? What is the medication? Okay. Yes, it is actually, the herbal medication is garlic. Good job. Garlic. Remember, garlic, 1 clove of garlic equals 4 grams. And because the herbal medication starts with a G, you cannot take it with aspirin, right? You cannot take it with Coumadin, heparin, or aspirin. All right. This medication, you don't want to give it to patients with C. diff. You don't want to give it to patients with C. difficile because they are already having the intended effect of this medication. This medication is used, actually, let me say it this way. This medication will stop what's happening to patients with C. difficile. That's how I want to say that. So if you think about what patients with C. difficile are having, this medication will stop that. Okay. What is it? That's all I want to say. If I say too much, you'll know it. You have to take it 30 minutes before a meal, and you have to watch for constipation because it can cause you to be very constipated. What is this medication? What is this medication? It is... Okay, I got to give you some more clues about it. It also starts with the letter L. That's it. It starts with the letter L. It's used to treat diarrhea. You have to watch because it can cause constipation. What is this medication? It's for diarrhea. That's what it is. And it starts with the letter L. It starts with the letter L. The generic name of it. Give it to me. Give me that. Give me the name of it in a generic form. Not something that I'm going to buy over the counter. Okay? And I know it's so tough when we're studying pharmacology because we want to just say the trade name, and we want to say the name we see on TV or the name on the bottle from the company, but we got to know the generic brand of it because NCLEX, they're not changing that. You got to know generic. Yes, loperamide. That's the answer I was looking for. Loperamide. Okay? Loperamide. Next medication is this. This medication is used to help remove fluid from the body. You have to be oh so careful because it is super fast acting. This medication will cause your potassium level to go down. It can also cause muscle cramps. Oh my goodness. This medication also can cause your ears to ache. Oh, your ears can hurt so bad when you're taking this medication. But it's very popular. A lot of people take it to help remove fluid from the body, but so much teaching. You got to watch for decreased potassium levels may cause this word ototoxicity, and especially if it's given with an aminoglycoside. What is this medication? And it can be used to help reduce fluid conditions like acute, what do I have here? Acute edema, pulmonary edema, or congestive heart failure. What is this? What am I talking about here? Very popular. Okay. Yes, I see it on the screen. Furosemide. Good job, furosemide. That's what it was. All right, guys, listen, this is how you study. This is how you study for NCLEX. I just came on here asking you guys very specific questions related to pharmacology tonight. I want you to pick up and study. Yes, pick up and study where we left off. When you guys are thinking about not doing it, I want you to remember your why. My why busted in on me today, right? So your kids are watching you. You're making huge sacrifices to get your goal accomplished. So don't make it for nothing. Put every day as the most important day to get it done. All right. No excuses. No excuses. We have a lot coming up. When we get off of this live, I want you guys to sign up for the Critical Thinking Workshop. Please make sure that you are in it. The workbook for that workshop will be coming out next week. And then we will actually have the event free here on Facebook. It will be at 8 p.m. on October 25th. So you don't want to miss it. This is the first time I'm doing a critical thinking workshop. This is the only time I am doing a critical thinking workshop. My year is already planned out. So I'm doing this for International Nurses Day to help, because my international nurses, absolutely, they love to show the ReMar community support, and I want to support them back. So even if you are not an international nurse, you need help with critical thinking, come on in, sign up for it, you guys. All right. I say this all the time. You can, you will, you must pass NCLEX. I say it because I believe it. I say it because I want you to believe it. Even if you're afraid right now, even if you have hesitations or fears, all you have to do is take one step forward today. So for some of you, that will be what you've done here. For some of you, that will be, hey, I just reviewed pharmacology with Regina. I'm good today. For others, it will be scheduling your test date. Maybe your step is going to remarnurse.com. Just go to the website. You've been studying with me for so long. Take the next step. Take the next step. Let me help you. All right. Get something to make your way a little straight. All right. Is it free? Absolutely. It's free. Absolutely. It's free. Just sign up for it. remarnurse.com. I'll put the link in the video too. How often do you do these videos? Listen, the best thing for you to do is turn your notifications on your page for me. So every time I go live, you will know. All right. And the best way to contact me, Team ReMar, is actually waiting to hear from you guys. Go to support@remarreview.com. Support@remarreview.com. We now have associates who are working in the evenings as well, so that some of you guys who are international nurses, you can get answers quicker. We are absolutely trying to make sure that whenever you reach out to myself, that you have the answers that you need. All right. Oh, awesome. I passed my quick facts using NCLEX. Yeah, you can also get this book on Amazon as well. You can go to Amazon.com and just get quick facts for NCLEX. Make sure it's the 5-star version. You can also get this book on eBay now as well. So I'm pretty happy about that. Abby, if you are testing, don't be afraid. Don't be afraid. Remember, your NCLEX test date, it's not a surprise. When your test comes up, it's not a surprise. You actually chose that date, right? You chose that date. So you own the day. It's your day. You picked it. All right. So just make sure that you wake up and know that you are not leaving that test center without your license. Don't do it. You've not come this far to give up. You are going to do all it is required to get your nursing license. Okay. So I appreciate your time today. October 25th, again, is the date. It's going to be an amazing Monday night at 8 p.m. Eastern time. We are critical thinking for NCLEX. I'll see you guys later. Have a great one. Bye-bye.